soaring high and making difference, where we talk anything about nursing. So let your voice be heard. Right here, Moments with Professor X. Hey everybody, good evening. Today is actually May 29, 2025, and it's 7:30 p.m. my time. And I believe it's a May 30, Friday in the Philippines, and that makes, let's say 10:31 in the morning. So good morning, Philippines. How's everybody? So I was supposed to do Facebook Live last week, but I took a break. And if you followed my page, I posted some sample questions for the NCLEX-PN, and I said that I'll be discussing the question, and we will answer the 15 questions and do the rationalization. So this is for my students at Las Vegas College, the LPN and the ADN programs. Anyway, how's everybody? Hold on, let me check, making sure that I also posted this on my other platform. Hold on. Ooh, who do we have here? Give me a few minutes. Hold on. Share. Where's that? Perfect. Hello to my good friend Van. How are you? I miss you. Baby Van. Hi. And thanks for watching to my good friend Cham. Hi Cham, how's your trip there in Australia? If you saw my picture, I posted some picture the other day. So he was a friend. He's also a nurse from Minneapolis. He used to work at Mayo Clinic and then moved somewhere else. Then he went to Australia for a short trip. So safe skies. Who else? Who do we have here? Hello to my batchmate, Don Damandaman Jr. Hello, and of course to all my high school batchmates, batch 1996. Okay, oh my God. So anyway, so let me share my screen and then let's answer sample questions for the NCLEX-PN. So for those who don't know what NCLEX-PN is, this is the state board examination if you want to work as an LPN here in the US. So there are two common types of the NCLEX. By the way, the NCLEX stands for National Council Licensure Examination. So there are two types of NCLEX, the NCLEX-RN and the NCLEX-PN. So the NCLEX-RN will be the state board examination if you want to work as a registered nurse here in the US. And if you want to work as an LPN or LVN, now some states they call it LVN, some states they call it LPN. So you need to pass the NCLEX-PN. So they're the same state board examination, but different discipline, whether it's an RN or the LPN, LVN. Anyway, so let me share my screen and let's go from there. Share. Right there. Okay. By the way, if you have any questions or reactions or anything bugging between your ears, feel free to drop a message, okay? Hello to Jaron Alvarez. Nice to see you again, Sir John. Hey, how are you, Jaron? Jaron is the Dean of College. Do we call it Dean? We don't call it Dean of College of Nursing, right? But I know he holds a high position in one of universities here in the US. Yeah, I'm just glad to be, to be back. So let's answer the first question. How do I do this? Okay, first question. Let's see. A nurse is caring for a client with a central venous catheter, enters the client's room and notes that the CVC is dislodged and lying in the client's bed linens. The client appears cyanotic, tachypnic, and diaphoretic. Which of the following actions by the nurse are appropriate? Select all that apply. By the way, this is a select all that apply question type. And if you will encounter a select all that apply question type, it is a plus minus scoring. Now, what do you mean by that? It means to say you get a point for every option or for every correct option that you choose. And you will lose a point for every incorrect option. Okay? Now, there is no negative score in your plus minus scoring. The lowest score you get is 0. Okay? Now, so you have 5 options here. So in the Philippines, it's A, B, C, D, E. Those are the options, right? So alphabet. In the NCLEX, it's numbered. Okay, so just remember, if you encounter 4 options, or you will have 4 options, most likely that is a form of multiple choice. And if you have more than 4 options, most likely that is select all that apply. So this type of question, select all that apply, is again a plus minus scoring type. If the type of question is select all that apply N, okay, it means to say they will tell you how many options you need to choose, then there is a partial scoring for that. So I just want to stress that. Now, there is such thing as select all that apply, and there is also another type, select all that apply N. Okay? So anyway, let's go back to the question. Which of the following actions by the nurse are appropriate? So going back, patient appears diaphoretic, cyanotic, and tachypnic. And you have a dislodged CVC. So if you will have a dislodged CVC, most likely your patient here is experiencing a form of air embolism, which is a complication, right? Now, thing to remember in your NCLEX that air goes to high altitude places. You don't want air to get inside the lungs, okay, causing pulmonary embolism. You don't want air to get inside the brain, causing cerebral embolism. So you need to understand that positioning plays a vital role here. Positioning, or you position the patient in such a way that it prevents entry of air to your lungs, prevents entry of air to your brain. So take note, the best position here is head lower than his feet and on left side lying position. Okay, so take note, if you suspect air embolism, the best position is your Durant's maneuver. Or when you say Durant's maneuver, you call that as you describe that as head lower than his feet and on left side lying. So we know that number 3 is incorrect. Your high Fowler's position is favorable and good to patient with pulmonary embolism, not air embolism. Okay, so you have to eliminate number 3. But look at your number 1. Administer oxygen via a non-rebreather mask. Is that an appropriate action to patient with air embolism? Yes, it is. Okay. Number 2, apply an occlusive dressing over the insertion site. Right. Okay. Why? Because this will ensure that it prevents further entry of air into the site, causing more air embolism. Okay. Number 4, monitoring vital signs and respiratory effort. Of course. Okay. And number 5, notify the healthcare provider. Yes. So with this question, the appropriate answers or options must be 1, 2, 4, and 5. Okay? So take note, this is a plus minus scoring. So you earn a point for every correct option and you lose a point for every incorrect option. Okay? So the best options are 1, 2, 4, and 5. Okay, hold on. Let me check if I still have the correct page and set up. Hey, what's going on? I think it's the opposite. I should switch the screen. Swap display. Let's see. Okay, swap. There, perfect. Okay, next question. The nurse is caring for a client with schizophrenia who is experiencing auditory hallucinations and has a new prescription for oral antipsychotic. Which of the following actions should the nurse take? Now, patient is diagnosed having schizophrenia and is experiencing auditory hallucination and has a new prescription of an oral antipsychotic. Which of the following actions should the nurse take? Provide music for the client, a gentle touch to calm the client, 3, instruct the client to ignore the hallucinations, or 4, tell the client that medication will alleviate the hallucinations within a few hours. Remember, if your patient is having auditory hallucination, be careful when you touch the patient because that could mean or risk harm to you as a nurse, because the patient can snap and then physically hurt you. So you're not supposed to do that. If you answer number 3, instruct the client to ignoring the condition, ignoring the problem, it's not therapeutic. So we eliminated 2 and 3. So look at your 1 and 4. Provide music for the client, or 4, tell the client that the medication will alleviate the hallucinations within a few hours. Take note, it is a new prescription. A new prescription will not take or give you a favorable effect immediately. If it's a new medication, a new antipsychotic medication prescribed to your patient, it will take days, not hours. Okay, days to reach a certain level in the plasma to give you a favorable or desirable effect. Okay, so the best answer here is number 1. Okay, provide music to your patient. Okay, who do we have here? Hello to Samson Bacora Jr. Thanks for watching. Hello to John Jules. Hello to Jezreel Fabrigar. Hey, how are you, Jezreel? Hello to JB Aranas Bagas. Thanks for watching. Let's proceed to the next question. So number 1 is the correct answer. Next, a nurse on an orthopedic unit is caring for 4 clients with a casted extremity. Which client does the nurse prioritize to see first? So this is a question about prioritization, right? So who will you see first, or who will you assess first? So that's the question. Who will you see first, or who will you assess first, or who will you prioritize first? Number 1, a client reporting a tingling sensation. Tingling sensation, that's your paresthesia. Okay, paresthesia is a manifestation of compartment syndrome. Remember, if your patient has a cast on an extremity, one common issue you need to understand is compartment syndrome. Now, what is compartment syndrome? Compartment syndrome, if you happen to watch my previous videos, I explained compartment syndrome. This is a condition wherein there is compression in the tissues and circulation due to edema or inflammation. It means to say that because of edema, because of inflammation or restriction, because of a cast, eventually it obstructs or compresses the tissues and obstructs circulation. That is a form of compartment syndrome. Okay, and the paresthesia is one of the many manifestations that your patient can manifest. Okay, number 2, client report itching under the cast. 3, client reporting pain. 5 out of 10 on movement. Therefore, why do we put the patient in a cast? The reason why we apply cast to your patient is for the purpose of immobilization. Now, we usually immobilize if you want to promote healing of a fractured area, like break in the bone. So it's reasonable, and it is expected that if you move the area with a fracture, there is pain. Okay, so number 3 is expected. And take note, if that is indeed a form of what you call this compartment syndrome, the pain score of your patient is not 5 out of 10. Usually it's 10 out of 10. It's severe pain. And take note, a patient with compartment syndrome has a pain that is characterized as severe and unrelieved by analgesic. Okay, what about number 4? A client reporting throbbing on dependent position. That is expected because it's you position the area dependent position. So that is expected. So you have to choose between 1 and 2. The correct answer is number 1. Tingling sensation, that's paresthesia. If you can still recall, can you tell me, I know I can't hear you. Can you tell me silently What are the signs and symptoms of compartment syndrome? So compartment syndrome, we have uh, six P's. If you can still remember, there is pain. I said pain that is unrelieved by analgesic. There is paresthesia, numbness or tingling sensation, or sometimes they will use funny feeling as a description for paresthesia. Pulselessness that usually happens on the late part. Poikilothermia, okay, means to say that there's inability to regulate temperature. That is why if you feel the skin of the patient with compartment syndrome because of poikilothermia, it's cold skin to touch. Okay, another P, there's pulselessness. Okay, there's no pulse. No pulse because of circulatory compression. And take note, pulselessness is usually a late manifestation of compartment syndrome and uncommon, actually uncommon. And letter P, last P, will be paralysis. Okay, so again, those six P's: pain, pallor, paresthesia, poikilothermia, paralysis, and what's the other one? Pulselessness. Okay. Hello and thanks for watching, Michael Agaspi. Okay, let's proceed to the next question. The nurse is preparing to irrigate wound of a 7-year-old client who sustained a laceration while on playground. Which of the following actions should the nurse take? Select all that apply. So take note, it's irrigating the wound. Okay. Now, when you irrigate the wound, of course, it may give you discomfort. So anticipate that it's best to give analgesic before the procedure, right? Oh, by the way, hey, Ma'am Hanilu Oponda, thanks for watching, Ma'am. Ma'am Hanilu is a clinical instructor in Cagayan de Oro City, Philippines. Anyway, so we usually give analgesic 30 minutes before the procedure. Okay, so why? So that patient can tolerate the procedure. Okay, so number one is a correct option. Okay, what about number two? Cleanse the wound from the most contaminated to the least contaminated area. So when you irrigate, are you going to start from the most contaminated to the least contaminated, or from the least contaminated to the most contaminated? The correct answer is from the least contaminated to the most contaminated area. Why? Because if you irrigate from the most contaminated to the least contaminated, there is risk of recontamination. Okay? So the best, okay, number two is an incorrect option because the best practice when you irrigate is to start from the least to the most contaminated. Okay? So number two is incorrect. Number three, obtain a 10 ml syringe and a 27 gauge needle. A 10 ml syringe is small. Okay? We usually use 30 to 50 ml syringe, and a 27 gauge needle is also small. Remember, the bigger the number, the smaller the bore. The smaller the number, the bigger the bore. So we usually use 18 or 19 gauge, not 27. Okay, so number three is incorrect. Number four, review the client's vaccination record. Of course, we have to check that. Sometimes if there is an open and a deep wound, doctors will order tetanus toxoid. Okay, number five, use continuous pressure to flush the wound and repeat until the drainage is clear. Of course. So number five is also correct. So the best options here are the following: 1, 4, and 5. Okay? So those are the correct options when you talk about wound irrigation. And by the way, if you say wound irrigation, what do you think is the best solution to use when you irrigate the wound? Remember, this is a question in your NCLEX. Regardless, take note, if it's irrigation, may it be bladder irrigation, wound irrigation, eye irrigation, ear irrigation, wound irrigation. If it's irrigation, the best solution to use is a normal saline, your plain NSS, okay, your normal saline. And by the way, patient having a wound irrigation or irrigation in general, you have to watch out for fluid volume excess. Okay, why? Because when you irrigate, there is a chance that the body will reabsorb that, causing fluid volume excess, not fluid volume deficit, but fluid volume excess. Okay, so let's proceed to the next question. The nurse is caring for a 5-year-old client with a sickle cell disease who is experiencing an episode of acute pain. The client has shortness of breath, nausea with vomiting, and severe generalized body and joint pain. Which of the following findings require immediate intervention. Check the exhibit for additional information. Okay, so patient is having sickle cell disease and experiencing episode of acute pain. So most likely your patient here is having a sickle cell crisis. By the way, sickle cell crisis, you also call this as your vaso-occlusive crisis. Okay, now don't forget that a patient with sickle cell disease, this is a blood issue, a blood problem wherein the bone marrow of the patient is producing a defective hemoglobin S. Okay, now because of a defective hemoglobin S, when the body of the patient, when the person exposed to a low oxygen concentration, just like if they go to high altitude places, remember a high altitude area has a low O2 saturation. So this will eventually cause hypoxia, right? So if the patient is hypoxic, the RBC, because of defective hemoglobin S, the RBC will have a sickling episode. So the hypoxia can cause sickling. And the problem with your sickling is that it increases viscosity in the blood. And that increased viscosity will result to clot formation. And there is clot. Eventually, it causes occlusion in the blood flow. So if that occlusion happens, you call that your vaso-occlusive crisis or your sickle cell crisis. So that is why there are two things you need to remember for sickle cell disease or sickle cell crisis. Number one, don't forget to hydrate your patient. Remember, because of sickling, there will be increased viscosity. Okay, an increase in the viscosity concentration, increased viscosity will lead to increased clot formation. So don't forget, you hydrate your patient. Number two, don't forget to give O2 supplementation. Why? Your O2 supplement will prevent sickling. Remember, the thing that triggers sickling is hypoxia. Now, sometimes in NCLEX, you'll be asked, what will you do first? Are you going to hydrate the patient, then give O2 supplement, or O2 supplement first, then hydrate? Okay, now don't forget that the best answer here is hydrate first, then after that you give O2 supplement. Why? If the blood is viscous and you give O2 supplement, there is poor oxygen adhesion. Your oxygen molecules will not adhere better or will not adhere, okay, better if the blood is viscous, if the blood is concentrated. Okay, that is why what will you do to promote good oxygen adhesion is to dilute it first, hydrate the patient first before you give O2 supplementation. Okay, don't forget that. Okay, and what else? Yeah, those two, hydration first and then O2 supplement. And what is the question again? Check which of the following findings requires immediate intervention. So which among the options there is a red flag will alert you most? Number one, enlarged spleen on palpation. Okay. Two, hemoglobin of 9.0. Remember, the patient is a 5-year-old, and in our exhibit, 1 to 6 years old, the hemoglobin must be 9.5 to 14 grams per DL, and your patient is 9.0. Reasonable because the patient is having sickle cell. So number two is reasonable. And by the way, what is your hemoglobin result that would require you to have blood transfusion? Usually, if the hemoglobin is less than 7, okay, we do blood transfusion. But again, depends on your facility. But usually, it's less than 7. Number three, bilateral swelling of the hands and feet. 4, pain rated 8 on the Wong-Baker's FACES scale. 8 is severe pain, reasonable because of sickle cell crisis. Now, which among the following findings will alert you most? The correct answer is number 1. Why? Enlarged spleen. Remember I said sickling. The most common site, okay, of sickling is actually the spleen. Okay, that is why if there is pain on the left upper quadrant, okay, when you palpate that, there is enlarged spleen on the left upper quadrant, you need to inform the doctor immediately because it can cause injury, damage, okay, in the spleen. Remember, your spleen plays a vital role for immunity. Okay? So take note. Don't forget that in your examination. Remember, spleen is on the left upper quadrant. And by the way, spleen injury, spleen problem can cause pain that radiates to your left shoulder, or sometimes they use left scapular area. Okay? Next. The nurse is positioning clients before and after scheduled procedures. Follow-up will be required if the nurse places a client in which position. It means to say, what option there is incorrect. that would require further, further teaching or further evaluation. So what option there is incorrect? Look at your number one. Fowler's position after cardiac catheterization via femoral artery. When you say Fowler's position, you elevate the head of the bed. Most likely it's 45 to 60 degree angle. Okay, remember there are three sub-classifications. You have your low Fowler, your semi-Fowlers, and then your Fowlers. Okay, your Fowler's position, your high Fowlers is usually 45 to 60 degrees. Okay, your semi-Fowlers usually 30 to 45 degrees. Your low Fowlers is usually 15, okay, 10 or 15 to 30 degrees. So if your patient had cardiac catheterization on the femoral artery, one issue you need to consider is bleeding post-op. That is why the best position post-cardiac catheterization is supine or flat on bed. Supine or flat. Can you raise the head of the bed post-cardiac cath? Answer, yes. Okay, but not greater than 30 degrees. Fowler's, I said, is 45 to 60. So you know that number one is a wrong option. No, you know what I mean? Wrong position. So that is the correct answer because we're looking for the wrong option, right? So to make it correct, it should have been low Fowler's. Did you get that? I hope so. Number two, right sideline position after percutaneous liver biopsy. That is correct because post-liver biopsy, you position the patient right sideline to add pressure on the punctured site to control or prevent bleeding. Okay? Three, Sims position before a soap side enema. Correct. Why will you position the patient's Sims position? To facilitate entry of the solution during soap side enema. 4, supine position after lumbar puncture. Yes, after lumbar puncture. Supine position or flat on bed. What is the purpose in positioning the patient that way? Supine position in order to prevent leakage of your CSF. Remember, during lumbar puncture, the doctor inserts a needle into your spaces in the lumbar area to aspirate or remove a small amount of your CSF. For analysis, okay, or for CSF electrophoresis or for CSF analysis. So because of that point of entry, there is a risk of CSF leakage. So to prevent that, you need to position the patient supine or flat on bed to close the punctured site, okay, to prevent CSF leakage. Because one issue is spinal headache, okay, post procedure. So to prevent that, position the patient supine position. Take note. The question, the situation is after lumbar puncture. But during lumbar puncture, how will you position your patient? If it's during lumbar puncture, side-lying knee-chest position. Okay, I hope that's clear. So we know for this question, the best answer is number one. What makes number one incorrect? Fowler's. It should have been low Fowler's position. Okay, don't forget that. Next, I don't know what number is this. Next question. The nurse is caring for a client with type 1 diabetes mellitus who is reporting abdominal pain and weakness. The client has a fruity breath and a rapid, deep respirations. Which of the following actions should the nurse take? Select all that apply. Now take note, don't forget type 1 diabetes. Remember, if you're following me, I've been saying this several times. A patient with type 1 diabetes, one common issue you need to deal is a complication called DKA or diabetic ketoacidosis. So a patient with DKA has a fruity breath, okay, ketone breath. Patient is acidotic. What type? Metabolic acidosis. So because of metabolic acidosis, expect that in the ABG of your patient, there will be a decrease in the pH and decrease in your bicarbonate. Because of metabolic acidosis, compensatory mechanism is the patient will hyperventilate. That is why rapid deep respiration is compensation, okay, of your metabolic acidosis. Okay? So what you think will be the appropriate options here? Select all that apply. Number one, instruct the client to breathe into paper bag. Breathing to a paper bag is ideal for patient who hyperventilate. And I said patient with metabolic acidosis hyperventilates. Correct? So if you let the patient breathe a brown paper bag or breathe your cup hands, you are correcting the hyperventilation causing respiratory acidosis. Allow it to happen because hyperventilation is a compensatory mechanism. Okay? So don't do that. So number one is incorrect. Number two, check the client's capillary blood glucose level. Yes, we do that. Usually we check the blood glucose of the patient with severe hyperglycemia, especially we give insulin hourly basis every hour. Number three, place the client in a continuous cardiac monitor. Yes. Why? Because a patient with metabolic acidosis, most likely they have hyperkalemia. Okay? And because of a metabolic issue, metabolic condition, it's best to continuously monitor the cardiac function of your patient for a possible dysrhythmia because of hyperkalemia. Remember, if there's too much potassium in the blood, hyperkalemia can cause deadly dysrhythmia and it may cause cardiac arrest. Next, number four, prepare the client for infusion of regular insulin. Why? Because a patient who has DKA is hyperglycemic. Okay? Number five, gather supplies for IV bolus of sodium chloride. Yes, remember, a patient with DKA, the first solution to use is an isotonic solution. After that, we use hypotonic solution. Okay? Hypertonic is contraindicated to patient with DKA. So again, select all that apply. The best options here are 2, 3, 4, and 5. Okay? I hope you got it correctly. So accept number one. Next. The nurse is preparing to administer an acetaminophen suppository to a 4-year-old client. Which of the following actions should the nurse take? Select all that apply. Okay? 1. Place the client in a side-lying position. Correct. 2. Guide the suppository along the rectal wall. Correct. 3. Use a gloved index finger to insert the suppository. That's correct. 4. Advance the suppository no farther than the external sphincter. No farther. That's not a good word. That's not a correct statement. It should be beyond the external sphincter. 5. Hold the client's buttocks together firmly after inserting the suppository. That's also correct. So select all that apply. The best options here are all except 4. So 1, 2, 3, 5 are the correct options. By the way, if you have any questions, please let me know. Drop a comment and I'll try to answer that. If you have any questions or any concerns, any violent reactions with my answers. Okay, let's proceed to the next question. The nurse enters the room of a client who had major abdominal surgery 1 week ago and notes dehiscence and evisceration of the surgical incision. The nurse notes the nurse should immediately place the client in the. Okay, so I hope you know the difference between dehiscence and evisceration. So that usually happens after surgery. Okay, so if it's abdominal surgery, to prevent dehiscence and evisceration, we usually put some abdominal binder. Okay, the abdominal binder is placed on top of the wound dressing, surgical dressing. So wound dehiscence happens if there's separation of the surgical site. So you call it dehiscence. Evisceration means there is already separation of the surgical site and there is protrusion, exposure of the abdominal organs. So let's say there is exposure of your patient's intestine or intestine. So you can see the intestine of the patient, okay, externally. So you can see that coming out in the surgical site. You call that actually evisceration. If there is no abdominal structure, no internal organs sticking out or protruding from the surgical site, that is just dehiscence. Okay, I hope that's clear. So what will you do? So will you position the patient low Fowler's position with the knees bent? Prone position? Oh, why will you position the patient prone? Okay, so prone is incorrect. 3, supine position with the head of the bed flat. Or 4, side lying position. Remember, there's a surgical site, okay, that separated, and then there's exposure, protrusion of internal structures. So the best answer here is low Fowler's, means to say you can elevate the head of the bed, but not too high, and knees bent. Why will you bend the knees of the patient? To relax the abdominal muscles. Okay? So the best answer here is number 1. Next, the nurse is caring for a client who is scheduled for surgery in 2 hours and is reporting anxiety and shortness of breath. The client has a heart rate of 110 beats per minute and a respiration of 24. Which of the following actions would be a priority for the nurse to take? Okay. Now, patient will have a surgery in 2 hours time, and patient is anxious and have shortness of breath with all those, vital signs. So, number one, will you give PO lorazepam? Two, place the client in Fowler's or high Fowler's position. Three, request a prescription for a bronchodilator, in short, a breathing treatment. 4, reassure the client that it is normal to feel anxious before a surgical procedure. What do you think is the best answer? Now, if you answered number 1, it's incorrect. Why incorrect? Lorazepam will help the patient, will calm the patient, right? Why is number 1 incorrect? Because it's PO. Remember, most likely, a patient is scheduled for surgery in 2 hours time is placed on NPO. Okay, so we don't give PO meds. So number 1 is incorrect. If you answered 2, place the client in Fowler's or high Fowler's, that's a good position. Patient considering is anxious and having shortness of breath. So to correct that shortness of breath, you need to position the patient upright to promote lung expansion, right? So number 2 is a possible answer. So let's save that. I'm not saying that that's the right one, okay? But it could be. Number 3, request a prescription for bronchodilator nebulizer treatment. The respiration of 24 is not really high, and that increased RR is related to anxiety. And there is an insufficient data to reveal that a patient is hypoxic and that requires breathing treatment. Okay? For reassure, never use that word in your NCLEX. If you happen to see reassure word, most likely it's an incorrect option. Never give false reassurance. So number 4 is incorrect. So we know that the best answer here is number 2. So why will you position that? Why will you position the patient that way? To promote lung expansion and to correct shortness of breath. Okay? So number 2 is the best answer. Next question. The nurse is caring for a client receiving peritoneal dialysis. Which findings are essential for the nurse to report to the care provider? Select all that apply. Do you know what is peritoneal dialysis? Peritoneal dialysis is a type of dialysis wherein we use the peritoneal membrane as a semi-permeable membrane. Okay, so when we do peritoneal dialysis, there is a catheter placed below the umbilicus. We call it catheter Assure Tank-Hoff catheter. Okay, and it is usually placed 3 to 4 centimeters below the umbilicus, and we instill a solution, a hypertonic solution into the abdominal area of your patient. And we use the peritoneal membrane as a semi-permeable membrane, and we call that solution instilled as your dialysate solution. Your dialysate solution is hypertonic, so it attracts fluid. Okay, and ideally, before you do peritoneal dialysis, you check the vital signs of your patient, you weigh the bag of the dialysate, and you weigh your patient. After that, same thing. You weigh the patient, you weigh the bag, okay? Check the vital signs of your patient as well, okay? And take note that the dialysate solution, the normal color, it's a clear, pale yellow. That is the normal characteristic of a peritoneal dialysate solution, okay? So, which findings are essential for the nurse to report? Number 1, cloudy outflow. Yes, a cloudy outflow indicates what? Infection. Okay, a cloudy outflow may indicate infection, most likely peritonitis. Okay, a bloody dialysate. Take note, a bloody dialysate is usually normal during the first exchange. Okay, but if the bleeding is so severe and even after the second exchange it's still bloody, there's something wrong, or most likely the best action there is to notify the doctor. Okay, low-grade fever, not good, because a low-grade fever may also indicate infection. Oliguria, there's a decrease in the urinary output of your patient. Remember, we do dialysis to patient with renal failure, right? So a patient with renal failure, especially on ESRD stage or end-stage renal disease, it is expected for the patient to be oliguric. Okay, so oliguria is expected, so not the best option. Pruritus, no, because again, a patient with a chronic renal failure, or CRF, they have a condition called, what do you call this? Because of a chronic renal failure, the ability of the kidneys to eliminate waste products are actually is impaired. So as a result, there will be deposition of urea on the skin of your patient. So there's uremic frost. So because of that condition, urea deposited, urea deposition, it causes pruritus on the skin, itchiness. So again, oliguria, pruritus are expected. Tachycardia, no. So it's not expected. It could mean that there is poor outflow in your dialysis. So because of poor drainage or outflow, it may cause shortness of breath, tachycardia, tachypnea. Okay. So the best answer here or options here are 1, 2, and 5. Okay. Now remember I said that we instill solution. Hold on. I want you to see me when I explain. Okay, where is that? Stop. There. So remember I said in your peritoneal dialysis, this is different from your hemodialysis, okay? In your peritoneal dialysis, I said we instill a solution. So there's an inflow and the outflow. So when you instill a peritoneal dialysis, don't forget to clamp the outflow tube. Okay, so we instill, and then after you instill, make sure that the dialysate is warm. Okay, when you instill, allow the dialysate to dwell in the peritoneal area. You call it your dwelling time. Okay, and then after that, you drain it out. So when you drain it, take note of the characteristic. I said it's a clear pale yellow. Cloudy is an abnormality. Brownish dialysate is also a problem. Why? Brownish dialysate indicates bowel perforation. Bloody dialysate is normal, especially on the first exchange. Okay? Now, I said that there are times where when you drain the dialysate, there is leakage or there's still dialysate solution that retains in the peritoneal area. So when that happens, patient may have fluid retention in the tummy, causing, of course, a dyspnea, shortness of breath. So the question in your NCLEX here, what will be your nursing action if the drainage of your peritoneal dialysate solution is slow or low? If the drainage is low than the initial volume instilled, your action here is to turn your patient side to side. Don't forget that. Turn your patient side to side to facilitate drainage of the dialysate. Hello to Sir Oliver Pareñas. Hi, sir. Sir Oliver Pareñas was my colleague. Used to be a clinical instructor as well. Hi, sir. Aloha. He's actually in Hawaii right now. How's everybody there? Okay, anyway, so that's your peritoneal dialysis. Your hemodialysis is different. Your hemodialysis is made possible because the doctor put an access route or access site. So it could be a form of AV fistula or AV shunt. It could be a form of your subclavian cannulation. Okay, so in order for hemodialysis to be possible, so in your hemodialysis, we poke, we access the avascular area of your patient, and then we poke the patient, and then we reroute the blood to the machine. And in the machine, there is an artificial kidney. You call that a dialyzer. So the dialyzer will clean the blood. After that, after the blood is cleansed, the blood goes back to the patient's circulation. So that's your hemodialysis. So we reroute the blood to the artificial kidney. And that's your hemodialysis. For your peritoneal, we don't do that. So peritoneal, no need to shunt the blood out. In your peritoneal, we instill a solution. So same, you check vital signs, weigh the patient before and after. Now, one common issue you need to remember for your hemodialysis is a condition called DDS. We're not talking about Duterte, okay? We're not talking about Duterte death squad, okay? DDS stands for dialysis disequilibrium syndrome, okay? Now, anyway, let's go back. Ano pang masabi ko? share. Okay, so next question. The nurse is contributing to the plan of care for a client with pertussis. Which of the following interventions should the nurse suggest, including in the client's plan of care? So pertussis is a form of a communicable disease brought about by Bordetella pertussis. Okay? So pertussis is usually characterized by 5 to 10 consecutive coughs. And on the last part, there's stridor or whoop. Okay? Pertussis is spread through droplet infection. Okay? So you know that number 2 is a correct option. Droplet spread. Okay? So, what was that? Which of the following interventions should the nurse suggest? Select all that apply. Number 1, monitor client's respiratory effort. That's true. That's correct. 2, implement droplet precaution for the client. Yes, I just said that. 3, place the client in a room with a monitored negative air pressure. Wrong, because a negative pressure room is followed only to patient in airborne precaution. Patient is not in airborne but droplet precaution. So number 3 is incorrect. Number 4, request a prescription for a cough suppressant for the client. Now, we don't do that. Do you know that cough is a form of defense? It's a form of protection. Okay? It's actually a reflex that will clear your lower respiratory tract. Okay? That is why coughing is good, because it's protecting you. It's clearing. Okay? It clears your lower respiratory area, just like your diarrhea. That is why if you have diarrhea, allow the course to happen, because diarrhea is good, because it's one way of eliminating, cleaning your colon. So if you ingested a contaminated food, a toxin, it can cause diarrhea. It can cause vomiting. Those are defenses of the body to get rid of whatever thing that you ingested that is toxic. But if the diarrhea is severe and prolonged, you gotta watch out for fluid volume deficit. So anything that is too much is not good. Okay, so anyway, number 4 is not a best option. What about number 5? Offer the client small sips of fluid frequently. Yes, small sips of fluid. Why? Because if the patient is having consecutive coughs, because that's a characteristic of pertussis, there's always a risk of vomiting and aspiration. And then, of course, it clears the throat of the patient as well. So small sips of water is okay. So with this question, the best options are 1, 2, and 5. So except 3 and 4. Okay, except 3 and 4. Let's proceed to next question. The nurse is caring for assigned clients. The nurse should first check the client with, again, who will you see first? 1, a sickle cell disease has a new onset of pain rated 9 out of 10. 2, pneumonia has a temperature of 100.6 and is receiving IV antibiotic. 3, Graves' disease was a heart rate of 110, a BP of 122/85. 4, diabetes mellitus who has a serum glucose level that is elevated and is requesting Lispro insulin prior to a meal. So who will you see first? Now remember this in your examination. NCLEX, if the condition is new, acute onset, new onset, most likely that is the best answer. You will see that patient first. Okay, again, who will you see first? Apart from knowing the ABC protocol, you know, ABC, airway, breathing, circulation, you know that. Okay, safety of the patient, we know that. I explained it in my previous videos. Apart from those test-taking strategies that I mentioned, if you happen to see a patient that is newly admitted, okay, has a new onset of manifestation, you have to see that patient or those patients. Now look at your number 1. There's a word new onset. Okay, so a new onset, acute onset, you have to see that patient first. Look at your number 2. Pneumonia has a temperature of 100.6, which is expected for patient with infection. And guess what? Patient is already treated with antibiotic. Will you see that patient? No. The situation did not tell you that the patient is in respiratory distress. It's not stated. Okay? So number 2, eliminate that. Number 3, Graves' disease. Graves' disease is a form of hyperthyroidism. In hyperthyroidism, there's an elevated T3, T4. So an elevated T3, T4 will increase the metabolism of your patient, resulting to increase in the heart rate, which is expected condition to patient with Graves' disease. That is why a patient with Graves' disease, to control patient signs and symptoms, we give beta blockers. Okay? Now, what else? Patient with Graves' disease, we also give, what do you call that? Okay, PTU, your propylthiouracil. It's a small white-colored scored tablet. Okay? What else? We give antidiarrheal, correct? Or if you failed, or if the doctor failed to achieve a euthyroid state, okay, to patient, then most likely doctors will opt for surgery. They will do removal of the thyroid called thyroidectomy. Okay? But anyway. So number 3, eliminate that. Number 4, DM. Of course, a patient with diabetes is expected to have an elevated blood glucose level. Will you see that patient? No. So the best answer is number 1. Okay? Number 1 is the correct answer. By the way, Lispro insulin is what type of insulin? Is that a short-acting insulin? Is that a rapid-acting insulin? Is that long-acting insulin? Intermediate-acting? Very long-acting insulin. Take note, Lispro. Aspart. Okay? Okay? Lispro, Aspart, your Humalog, Novolog, these are your rapid-acting insulin. So Lispro insulin is a rapid-acting insulin. Okay? So anyway, the correct answer here is number 1. Next, the nurse is monitoring a client during the dwell time of peritoneal dialysis cycle. Which of the following findings would require immediate follow-up? Report of intermittent nausea, crackles on the lung bases bilaterally, +1 pitting edema of the ankles and feet bilaterally, or a blood pressure of 168 and a heart rate of 72. Remember, dwelling time, that is the time when you let the dialysate stay in the peritoneal area. Dwelling time. The correct answer here is crackles in the lung bases bilaterally. That would mean fluid congestion. Okay? 1, 3, 4 are all expected to patient with renal failure. Next. So number 2 is the correct answer. Next question. Which of the following are correct nursing actions related to client positioning? Select all that apply. Which of the following are correct nursing actions? We're looking for the right statement, right option. Okay? Number 1, position client in Fowler's position after cardiac cath. Wrong. I said it should have been low Fowler's. Okay, post-cardiac catheterization. Number 2, position client in Trendelenburg on the left side if air embolism is suspected. Remember, I said if it's air embolism, head lower than his feet and on left side lying position. So number 2 is correct. 3, client on the left side following liver biopsy. Incorrect. It should have been right side lying. So number 3 is a wrong position. 4, position the client on the side with head, back, knees flexed during lumbar puncture. Correct. That is a correct position during lumbar puncture. 5, position client with arm raised above head for chest tube placement. That's also correct. Okay. Now, why will you do that? I don't know if you can see me. Okay, so you do that, okay, during chest tube placement. Why? Because it widens the intercostal space. It will facilitate easy introduction or insertion of the needle or the catheter, okay, during chest tube placement. Now, anyway, I want to stress cardiac catheterization. So cardiac catheterization is a broad term. One good example or 2 common examples of cardiac catheterization is your angiography, and then you also have angioplasty. Okay, so that is a procedure. Angiography is actually a procedure wherein the doctor threads a catheter into the heart and guided by a wire, and then the doctor administers contrast or dye. So once the doctor administers contrast or dye, they will see where is the location of clot, And with this angiogram or angiography, they will know the degree of obstruction, whether it's complete obstruction or partial obstruction. And if there is multiple clot, they will see that, and where's the location of the clot. So that's a good thing. So that's your angiography. So when the doctor sees there is an obstruction, they may treat that by opening the blood vessel. You call that your angioplasty. Now, they're both types of cardiac catheterization. Okay? Thing to remember, in your angiography, if the doctor uses a contrast or dye, don't forget that contrast or dye generally are nephrotoxic. It means to say it causes damage, injury to your kidneys. That is why, as a nurse, don't forget in your NCLEX exam, if your patient is to undergo this test and uses a contrast or dye, make sure that you have to check the patient's urinary output. Don't forget that. Check the BUN and the creatinine levels of your patient, and check the levels of the potassium in the blood. Why? An elevated potassium in the blood, increased BUN creatinine, a decrease in the urinary output. Okay? Doctors will not usually use contrast or dye because those are indications of kidney injury or kidney problem. So the moment they give contrast or dye, the more it causes, damage to the kidneys. But there are cases that even the patient has kidney issues, doctors will still use contrast or dye because it's a must. It's needed by the patient. So what do they usually do if they need to use contrast or dye? Based on my experience, what we usually do and what I usually see in the hospital is that they will hydrate the patient. They will give bolus of fluid before the procedure. And then after the procedure, after using a contrast or dye, they give another round of fluid, another bolus again. So hydrate, bolus before the procedure, then give the contrast, and then another bolus after the procedure. Okay? Anyway, but nevertheless, however, if the patient is in your NCLEX examination, kidney injury, no contrast or dye, because again, it's nephrotoxic. Okay? I hope that one is clear. What else? Yeah, I also already mentioned air embolism, lumbar puncture. I said that. Chest tube, I already said that. Okay, let me share my screen. Let's look at a few more questions and we're done. Anyway, who do we have here? Hello to Ivory Lau Morsales. Hello, Sir John. Hi. Thanks for watching, Ivory. Where are you from, Ivory? Let me share my screen. By the way, if you have any questions or concerns, please let me know. Okay, let's proceed to the next question. Oh, by the way, we already answered that. Next. Oh, here. The nurse is caring for a 22-year-old client. Look at the nurse's note in the intensive care unit. So, time, it's 7 p.m. It's 1900 hours. The client underwent right popliteal artery repair 4 hours ago and reports persistent pain, 10 out of 10, despite IV morphine. The pain worsens with passive ankle movement. The right lower leg is swollen, tense, and tender. The right foot is numb, pale, and cool to touch. Pedal pulses are palpable bilaterally. So again, most likely it's what? Compartment syndrome. Okay? So with the following vital signs. Pulse is slightly elevated at 110. Normal is 60 to 100. Temperature is normal. Respiration is okay. Blood pressure is fine. O2 saturation is okay. So one thing that is off in the vital signs is the patient's pulse. Okay, but the rest, it's okay. So most likely, a patient here is having compartment syndrome. Okay, so here's the question. Complete the following sentence by choosing from the list of options. Okay, so the nurse recognizes that the client is most likely experiencing blank and should blank. Okay, so experiencing, you have to choose among cellulitis, DVT, compartment syndrome. So I said most likely it's compartment syndrome. And should what? Should what? prepare the client for fasciotomy, elevate the leg, and apply ice packs, obtain a Doppler ultrasound of the lower extremity. So what will you do? Elevate the leg and apply ice pack. Ice causes vasoconstriction, and vasoconstriction can cause further obstruction in the normal venous flow or blood flow. So that is incorrect. So the best answer here is prepare the client for fasciotomy. Okay? So prepare the client for what is fasciotomy? Fasciotomy is making an incision in the fascia. A fascia is a layer of tissue just above the muscle. So you have your skin. Okay, remember the layers. The layers, you have your, not the layer of the skin. You know the layer of the skin, epidermis, dermis, okay, subcutaneous tissue. So below your skin, then you have your fascia, then you have your muscles. Okay, so the doctors will make an incision in the fascia to release the pressure. Okay, so that's one management for patient with compartment syndrome. Well, actually, for burn injury who develop compartment syndrome, there are 3 common approaches to correct that. Number 1 is hydrotherapy. Okay, the doctor uses a whirlpool, and then for hydrotherapy, the doctor will immerse the burn area in the water to soften the tissues. That's the first treatment to correct compartment syndrome. If hydrotherapy is not effective, the hydrotherapy is a preparation for the next procedure. And the second procedure is your debridement. Okay, or you call this as your debridement, escharotomy. There is incision in the eschar. Or removal of the eschar is your escharectomy. That's your debridement. If still with compartment syndrome, then doctors will do fasciotomy. Okay, so those are common approaches to correct compartment syndrome, especially to patients with burn injury. Don't forget that in NCLEX. So for hydrotherapy treatment, remember the whirlpool. Not only one patient uses that. So one complication of whirlpool hydrotherapy is cross-infection. Another complication of hydrotherapy whirlpool is acute hypothermia. Because when you immerse the burn area in water, there is released heat loss. So that will result to acute hypothermia. So the earliest complication that you can anticipate is acute hypothermia. Late complication of hydrotherapy is infection. Okay, don't forget that. Anyway, what is this? Same question. This is a sample question in your NCLEX. Same thing. So let's have a case. This is the last question. A case study. Oh, here. What is this? Ivory Lau Morsales from Davao City, Philippines, Sir SP Shan, 2005. Oh, big shout out to all clinical instructors of San Pedro College. Hello, nursing department. I used to be a CI. Used to be a clinical instructor of San Pedro College, my alma mater. Hello to the Dean of College of Nursing sa SPC. Hello, ma. And of course, my colleague. Okay, here. So this is an NCLEX-PN. So remember, in your NCLEX-PN, I just want to emphasize this. If you're planning to take the NCLEX-PN, all students who are planning to take the NCLEX-PN expect that you will encounter 3 case studies. And every case studies, you will have 6 questions. So a total of 18 questions. Why? You will have 3 case studies, and every case study is 6 questions. So 6 times 3 is 18. Okay, so don't forget that. So here's the situation. The nurse is caring for a 20-year-old female client. Look at the nurse's note in the urgent care. God, it's very lengthy. The parent brought the client to the clinic due to vomiting and weakness. The parent states that the client has experienced sore throat and nasal congestion for the past week. The client has had 4 episodes of emesis during the past 24 hours and diffuse constant abdominal pain. The parent also reports that the client has an increased thirst and urine output over the past 2 months. The client's last menstrual period ended approximately 6 weeks ago with no abnormalities. Pregnancy status is unknown. The client does not take any medications and does not use tobacco, alcohol, or recreational substances. Family history includes hypertension and diabetes mellitus. The client appears drowsy and is oriented to person and time only. The abdomen is soft without rigidity or rebound tenderness, and bowel sounds are normal. No blood is present in emesis. Respirations are rapid and deep. Breath sounds are clear. Look at the vital signs. Temperature is 98.8, that's okay. Pulse rate is 128, that's high. Respiration is 30, that's high. BP of 88/60, that's low. And the finger stick blood glucose is 600, that's really high. So what do you think is your patient experiencing? For me, the patient is experiencing shock. Why shock? Because of hypotension, which is 88/60. Respiration is 30. Pulse is 128. So tachycardia is a compensation here. And the blood glucose is 600. That's really high. Normal is 70 to 110. Okay, milligrams per deciliter. That's really high. Okay. So click to highlight below. So these are 6 findings that would require immediate follow-up. Pregnancy status is unknown. Why is it important for you to know whether the patient is pregnant or not? Because there are medications or treatment that can harm the baby inside the uterus. So you should know whether your patient is pregnant or not. Okay, another findings that would require immediate follow-up: drowsy and oriented to person and time only. And of course, those vital signs and a blood glucose of 600. Okay? Next, for each potential finding below, click to specify the findings is consistent with the disease process of DKA, ruptured appendix, or ruptured ectopic pregnancy. Each finding may support more than one disease process. So let's take note. Patient has DKA. So if you have DKA, will you have polyuria? Yes, because in DKA, there is hyperglycemia, and hyperglycemia will have polyuria manifestation. Vomiting? Yes, present to patient with DKA. Tachypnea? Yes, remember I said there's hyperventilation. Tachycardia? Yes. Hyperglycemia? Yes. Abdominal pain? Yes. So you have to check all these findings under diabetic ketoacidosis. Okay? What about for ruptured appendix? Do we have polyuria in ruptured appendix? No. Vomiting? Yes. Tachypnea? Yes. Tachycardia? Yes. Hyperglycemia? No. Abdominal pain? Yes. Okay, ruptured ectopic pregnancy, actually the same with your ruptured appendix. So you will have vomiting, tachypnea, tachycardia, and abdominal pain, except for polyuria and hyperglycemia. Okay? So don't forget that. So this is again a plus-minus scoring. So if it's plus-minus score, you gain a point for every correct option and you lose a point for incorrect option. Okay? Next. Complete the following sentence by choosing from the list option. Based on the clinical findings, the client is most at risk for blank as evidenced by the client's blank. So risk for what? You have to choose peritonitis and sepsis, fluid volume deficit and hypovolemic shock, or intra-abdominal hemorrhage and hypovolemic shock. For me, I think the best answer here is fluid volume deficit and hypovolemic shock. Okay? Why? Why did you say fluid volume deficit? Remember, patient, if you look at the history, at the notes, there are episodes of emesis. So patient is throwing up. Okay, so most likely it's fluid volume deficit. As evidenced by clients, what? For me, as evidenced by patients, abdominal pain, no. Date of last menstrual period, no. But as evidenced by patients, vital signs. So the correct statement will be, based on the clinical findings, the client is at most risk for fluid volume deficit and hypovolemic shock as evidenced by the client's vital signs. So again, this is 0-1 scoring. So you get a point for every correct option. No deduction for an incorrect option. Okay? We're almost done. The client is transferred to an inpatient care facility. Which of the following orders should the nurse expect for the client? Select all that apply. Look at the lab result. Blood glucose of the patient is 537. Normal is less than 200. Potassium level of the patient is 5.7. It's high. So based on patient's lab results, patient has hyperglycemia and hyperkalemia. So increased blood glucose and increase in the potassium. So select order apply. Which of the following orders should the nurse expect for the client? Insulin IV infusion. Yes. Continuous cardiac monitor. Yes. Hourly finger stick blood glucose. Yes. Dextrose 5%. No. Remember I said we use only isotonic for DKA. Then we follow that with your hypotonic. We do not use hypertonic. It's contraindicated. So number 4 is incorrect. Number 5, rectal sodium polystyrene sulfonate. This is your kayexalate. Why do we have to give kayexalate? We give kayexalate to patient with hyperkalemia, correct? And we know that the patient is having hyperkalemia. So do we still need to give kayexalate rectally? No, because we're already giving IV infusion of insulin. Your insulin will already correct hyperkalemia. When you add more kayexalate, then you put the patient at risk for hypoK. Okay? 6 strict I's and O's. That's also correct. So the best options here are the following. 1, 2, 3, and 6, except 4 and 5. Okay, I hope that's clear. Next, drag the words for the choices below to fill in the blanks. The nurse gathers supplies for medication administration. The nurse recognizes that the priority prescriptions are blank and blank. Word choices, 50% dextrose, IV PRN. No. Why would you give dextrose? Remember, the patient is already hyperglycemic. Word choices, normal saline IV bolus. Yes, remember I said you have to hydrate your patient because a patient with DKA is dehydrated. Remember, the initial solution again is isotonic. So number 1, okay, isotonic. So 0.9% is the best option there. Potassium chloride IV. How will you give potassium? Patient is hyperkalemic. Wrong. Regular insulin IV infusion. That's also correct. So the best answers here are 0.9% sodium chloride IV bolus and regular insulin continuous IV infusion. Okay? So those are the correct options. So if you look at the screen, that's the same question. Okay? So the best answer, again, 0.9% sodium chloride IV bolus and a regular insulin IV. Okay. Here. Last question. The nurse reinforces teaching about managing diabetes mellitus during an acute illness. For each statement made by the client, click to specify whether the statement indicates correct understanding or incorrect understanding. Take note. Number 1, I should not take insulin if I cannot eat due to nausea. Is that a correct statement or incorrect? That is an incorrect statement. Okay? 2, I should drink extra fluids to stay hydrated when I am experiencing illness. Is that a correct statement? Yes, that's a correct statement because again, if there is illness, then the more it increases your insulin requirement. Do you know that illness stress can cause more hyperglycemia? And remember I said DKA has dehydration. So hydrate. Drink more fluids. Next, I will check my blood glucose level more frequently if I am experiencing an illness. That is a correct statement because again, illness can cause hyperglycemia. Okay? Next, I need to check my urine for ketones if my blood glucose level are persistently elevated. Correct. Because your DKA, okay, your DKA will have ketones, so you will have ketones in the urine. That is a correct statement. And by the way, when you say DKA, what is the blood sugar level of your patient that will increase your likelihood to have DKA? The answer is if the blood glucose is greater than 250 milligrams per DL. So the higher the blood sugar level, the most likely you will have DKA. Next, I will reduce my carbohydrate intake if I experience high blood glucose levels during an illness. That is an incorrect understanding. Okay, we don't do that. Remember, true that high glucose are expected during illness, but you don't necessarily need to reduce your carbohydrate. Okay, so you need to consult and collaborate that with a dietitian as well, a nutritionist dietitian. Okay, so remember, a diabetic diet is still considered a well-balanced diet. So these are the answers. Okay, so it took me 45 seconds to answer that, and good thing I got it correctly. Okay, so that's it. Let me see, who do we have here? Hello to my friend Angela Solomon. Hey, how's everybody there in Erie, Pennsylvania? I miss all the second floor nurses. Was it 2 North? I forgot the nurses station. Was it 2 North? Anyway, big shout out to all my colleague, fellow nurses in Erie, Pennsylvania's St. Vincent Hospital. That's the hospital where I worked initially when I arrived here in the US. Anyway, so that's all, nurses. Thank you so much. If you have any questions or concern, please drop a message, or feel free to drop a message or whatever. Comment below if you want to ask something. Okay, and what else? I'll throw more questions soon. We'll see. So as again, it's me, Sander, saying bye for now. Hope you learned something. God bless everybody. Bye.